Welcome, my friends, to the Bob and Brad podcast. My name is Mike Kienitz, and today I am interviewing Dr. Carl Rothschild, who is a chiropractor and founder and owner of Trifecta Light Technologies, which is a leader in LED, infrared, and red light therapy. Today, we are going to be talking about the benefits of red light therapy, what conditions or diseases that it can help, and how it works specifically. So without further ado, here is Dr. Carl Rothschild. Well, welcome to the program, Dr. Carl Rothschild. Thank you so much for joining me today.
I'm thrilled to be here. It's such a pleasure, and I love having the opportunity to kind of tell the world a little bit more about red light therapy than they probably know up to this point.
So I'm not sure if you're familiar with this, but as soon as I read your last name, I immediately thought of an old Iron Maiden song called Wrathchild. I know it's spelled different, but I don't know if you've ever gotten that before. But
No, but I can tell you that the name Rothschild has been problematic because some people think I own the world, and I wish it was true, but I probably wouldn't want to. But I don't. And for those of you that are wondering, it ain't me.
Well, that's good to know. So today we are going to be talking about red light therapy specifically. So would you mind telling our audience how you got started in this field?
Yeah, and in celebration of that, I'm wearing my red light shirt. So how did I get involved? So it was 1972. I was a junior at Stony Brook University, New York, which is a very good school. And I was a science fiend. I loved biology and everything to do with science. But I couldn't understand how exactly it was going to translate into a career for me until someone introduced to me chiropractic. Now, I got to tell you that back then, chiropractic was about 2 notches below voodoo. So it wasn't really well respected, but it intrigued me, some of the things that I was hearing about it. And I started calling chiropractors all over the country. And everyone I spoke to loved what they were doing. Now, I was in 72, I was a bit of a hippie of myself. And my version of a hippie kind of meant that I was going to be what I wanted to do is help as many people as I could. And money was not going to be my main focus. I don't mind making money. And even today at 73 years old, my focus is helping. So I get a kick out of helping people. And there are other people like me. A lot of people are like me. Not everybody. And that's why I kind of make a lousy businessman. From what I can see in the world of business is that it's not about helping people necessarily. So at any rate, and so I started as a chiropractor in 1978, and I loved what I was doing. I was helping a lot of people, and and I was making money, but it wasn't, again, my focus. And then about 20 years into my practice, when I'm a wise guy from New York, so knowing everything, I didn't think anyone was going to teach me any new tricks, for example. And then this medical doctor who brought red light therapy really to the forefront in the United States brought me what looked like a flashlight. It was about this big, and it would shine. He said, "Look, you're going to shine this on your patients, and it's going to make a big difference. So help me save the world, so to speak." And I thought he was crazy. Of course, I'm rolling my eyes, I'm sure. I thought he was nuts, but I knew him well enough that I was going to be respectful enough that I said, okay, yeah, I'll try it in my practice. And within a relatively short period of time, it absolutely revolutionized my practice. So, and we were having fun doing this. I mean, there were people that had issues that I didn't even think I could assist. So I would go to my patients and say, look, the one thing we know about this is that it couldn't hurt somebody. And the upside is potentially significant. So I would say, what do you have other than what you've already told me you have? So this lady said she had gum disease. I helped her. This guy said he had kidney problems. I helped him. This guy had a ripped Achilles tendon. We had already sent him to do orthopedics for a surgical review. He needed surgery. That's how bad this rip was. But they booked him for several days later. So I said, well, let's treat you every day with the light. And when he went for the surgical review, he didn't need the surgery. That's when I started realizing, okay, this is huge. And over the years, the lights got stronger. We went through, different phases of lights until about 15 years ago, when, give or take, when it was discovered that there was an element of light that could actually help with fat loss. Now, you got to understand that in this country, in the United States, there's not too many things that's as big as weight loss. And you can do it with red light therapy in a way that's completely healthy. It's non-invasive, doesn't hurt. There's no downtime. You're not killing anything off. So it's not like freezing fat, boiling fat, lasering fat. You're not using radio frequency or ultrasonic cavitation. All of those are about destroying fat cells. That's not what this does. What they found, and they didn't know this right away, they thought it melted the fat or liquefied or whatever. That's not what happens. What happens is that the certain element of red, only red, no other color, no other energy, red light can actually change the fat cell wall temporarily to allow some of the contents to leak out into the surrounding tissue. And it works. If the person will be not on a restrictive diet, anyone's going to lose weight if you have 200 calories a day or some junk like that. We're looking for somebody to be on what we'll call a life-changing, and I hate using the word diet, but for now I'm going to use the word diet. And the reason why I don't like the word diet is because you assume that with a diet there's a beginning and an end to it. And when that diet ends, the person's going to put all their weight back on. We're looking for the person to incorporate smart eating, which is essentially calorically neutral. Not if they were to eat anything more than that, they'll gain weight. If they eat less, they might lose a little bit of weight. But most people won't sustain a diet where there's a lot of restrictions. So we put them on a calorically neutral diet that's relatively easy to stay on, and add red light therapy to it, and it works. It's really cool. So at any rate, that's when I started getting involved with manufacturing. And we were involved with lasers and pads and things where we were treating parts of the person's body. Now, I'm mentioning this because that is a significant phrase, what I just said, parts of the body. So then about several years ago, when COVID first hit, right from the beginning, our practitioners wanted some way to treat patients without as much physical contact between them and their patients. We wanted the providers to be able to not be in the room with the patient. So we created this bed. Now, can you see my background where you see the bed here?
I can make it. They can see it now. Yep.
There you go. So this is model 9. But so we're talking about years ago when we came out with the first rendition of this bed, it was just supposed to be a replacement for what we had been manufacturing up to that point. And again, you just can get in and out of bed yourself. You don't need staff. So when someone says, what does it cost? I said, well, first of all, you're going to save thousands of dollars a month on not needing staff. So the person gets in the bed, they get out of the bed, and they leave. So that's how simple it is. And that's all we thought that this thing was going to do, just be a replacement of what we had been manufacturing up to that point. But within a month or two of us delivering the first series of beds, it changed everything. We were hearing things that were outrageous, incredible, miraculous. And I know it's supposed to sound scientific, but I don't know what else to say. It's unbelievable. So for example, we had a guy that was having heart attacks. So 20 years ago, he had pretty serious congestive heart failure. About 13, give or take, years ago, it got so severe he was starting to have regular heart attacks, like once a month, then twice a month. And by the time we meet him 12, 13 years down the road, he's having them as much as twice a week.
Jeez.
Now, how does somebody survive heart attacks? They had implanted a defibrillator into his chest, so every time he died, it would zap him back to life. But that was basically a death sentence for him as the heart attacks were getting worse and worse, and nobody had an answer for him. Nobody had an answer for him. In fact, when I do my live lectures, I'll often have people raise their hand and answer the question of, what would you do if somebody's coming to your office and they're having a heart attack once or twice a week? What would you do? So the acupuncturist, what are you going to put different needles in them? Chiropractor, and I love chiropractor. I am a chiropractor. We don't have answers for this. So I told the practitioner when we first heard about this to put the patient in the bed for just 5 minutes. Remember, the only thing that we know for sure, or one thing we know for sure, is it couldn't hurt. In the 50 years they've studied this technology, there's never been a recorded side effect. And with that in mind, also, on the other hand, the word contraindication means, Well, who can or cannot get in the bed? And the truth of the matter is, really, there technically are no contraindications. So you can get in the bed with a defibrillator or a pacemaker or electronics or metal implants or shoulder replacement, knee replacement. No problem. In fact, as soon as you have the surgery, get in the bed and you'll recover much faster. So no side effects. Essentially, the only contraindication that we have is it's just a recommendation for pregnant women. And the problem is that if that baby is destined to come out abnormal, when that baby comes out, they're going to want to blame anybody that was in the neighborhood. And I just tell our people, let's not be in that neighborhood. So while she's pregnant, great. The day after she delivers, get her in the bed, especially if she just had a C-section. She'll recover so much faster from that. It will be unbelievable. So there we're talking about side effects. At any rate, as you can tell, I'm a little excited about this stuff. So they get in the bed, they get out of bed. This guy gets in the bed for that 5 minutes, goes home that night, and he's never had a heart attack since. He's had more treatment, but he's never had another heart attack ever. And everything has come back to life. His health is one thing he says, and what I'm going to do is I'm going to send you the various videos that I recommend all of you watch, because I think they are, if you're kind of like me, like I get a kick out of helping people. If you're not like that, yeah, I think you'll still be interested. But if you like helping people, watch these videos and see the kind of miraculous changes that happen. So he's never had a heart attack since. As I said, everything's come back to life. And one thing he says in the interview that we did, that I want you to watch that video, and his name is Arnett. He goes, one thing he did not expect is that his energy would be through the roof now. So he could barely walk in the past. You know, when we saw him, just to take, he used to be an athlete before all this started, just taking, a few steps down the block, he's already out of breath. And now everything's back to normal. So at any rate, yeah, that was when we realized, okay, what we learned is that when you bathe the whole body at the same time, not just through the shoulder, elbow, with the whole body, head to toe, left and right, front and back, and inside and out, affecting as many cells of the body as possible, that's when the miracles happen. So I don't mind people talking to us about masks or helmets, or we make masks and pads and stuff like that, but I don't really promote it that much anymore because I'm into miracles. And with the miracles, again, the person can get in and out of bed themselves. They don't need help. And yes, it's not something that's, cheap that you can just buy on Amazon. In fact, the majority of stuff on Amazon is junk. What can I do? I can't stop it. But you want the highest medical grade beds that you can possibly get in. And that's what we manufacture. We have the lowest price, but most superior bed on the market. And yet and still, it's not necessarily something that people will buy for their home. So they go to one of our hundreds of locations that we have all over the country. And it isn't difficult. You go to the website, which is trifectalight.com. And again, it's, I don't know if you can see the Trifecta light. There it is.
Yep.
So I don't know if you can see my hand. So it says trifectalight.com. So if you go to trifectalight.com and go to the Contact Us page, and on the left side of that page, it's basically asking for you to find a location closest to you. And we'll do that. We'll find the closest location. And here's what I'm going to make a little bet with you. What I want you to do is to use it 3 times a week for 2 weeks. That's 6 visits. Each dose is only 12 minutes. Remember we talked about Arnett that got in the bed for 5 minutes, and it made life-changing changes for him and improvements for him. So for 6 visits at 12 minutes a dose, that's, again, after 2 weeks, you'll then do a reassessment with the practitioner there. But I'd like you to come back to the website, go back to the Contact Us page on the bottom of that. You have an opportunity to respond and tell us, how did those 6 visits go? And I could tell you that right now, pretty much everybody will notice a change, a nice, beautiful change. And I challenge you, and in fact, the worse off you are, typically the more dramatic the change will happen. So if someone feels great, they've never felt this good in their life, getting in our bed, they might not see a change because they're already great. But the worse off you are, the more difficult the issues that you have are, including Parkinson's, dementia, Alzheimer's, multiple sclerosis, almost any autoimmune disease, kidney issues, diabetes, heart issues, which we already talked about, Lyme disease, skin issues, musculoskeletal problems. That means any muscle, tendon, ligament, bone, joint, I don't care. And any neuropathy. So whether it's peripheral neuropathy like you might get after diabetes, or regular neuropathy from any skeletal or spine issues, the results are nothing short of spectacular. And so I can't guarantee, but try it for 6 visits and see if you notice a difference. And I'm a betting person that I'm telling you more than 90% of you are going to see a change. Now, if you have something that's so horrific, like the worst state of Parkinson's, for example, it might take, after 6 visits, the change might be a little bit more subtle. You might take 2 months before you see some beautiful changes. But normally it doesn't take that long. We had this one lady, her tremors were so severe from her Parkinson's that she was embarrassed to go to church because she couldn't hold the Bible. And after 2 weeks of getting treatment, she still has the tremors, but they're so much more mild that she's easily able to hold the Bible and read it. So what I'm saying to you is that I would challenge any of you to come up with any condition that we haven't seen great results with, because so far, everybody I've spoken to and all the feedback we've gotten has been unbelievably positive. So at any rate, there we are, treating with the bed, having great results. Our bed now is like model 9. So we're making improvements. We're making all kinds of things to make it even better. In fact, I just wanted to talk to you about, well, what should you look for? First of all, I'm telling you want a full body device, head to toe. So you're going to go to some facility that has that. I suggest ours because we have the most premier lights. You want these, what they call medical grade lights that don't get hot. Heat is the enemy. Heat dilates blood vessels, brings more fluid to the surface, blood in particular, and that would block the penetration of the light. So you don't want anything that's going to create more circulation just prior to us using lights on you. Now, afterwards, you can do whatever you want, but healthy-wise. But before, we like a virgin body is what we sometimes will call, where the person's at resting state, their pulses at 70 something usually, and everything's calm. Then our lights can penetrate deeper that way. So the light should be strong without heat. That's number one. Of course, I already mentioned full body coverage. Also, that top canopy, when it comes down onto the body, it should come right down onto the body. Most of the other devices out there are like, they cover the whole body, but the high arcing dome, the dome is very high arcing. So the lights are very far off the body. And ours, the lights come right down onto your body, not the weight of it, but it approximates your body. So you want the lights as close as possible. Another thing is you want the ability to customize the treatment. So someone who's 80 pounds is not getting the same dose as someone who's 400 pounds. Now, a 400 pounder has a lot of flesh, and we can put a lot of power into this, and they won't get hot. Whereas an 80 pounder has next to no flesh, and so we can't have the same power that we do with the 400 pounder. So we have the ability of lowering the power both to the red light and to the near infrared light. Our bed is integrated with red, which we talked about for fat loss, and some healing, and this thing near infrared. And so to that end, let me also jump around for a second and tell you the word infrared, there is no such thing as just infrared. So it's either far infrared, which is hot, or near infrared, which is not hot. They call it cold, but it doesn't literally get cold. It just doesn't get hot. We only use near infrared, not just because it doesn't get hot, because the depth of penetration and the effectiveness of what it does, which I'm going to review in a moment of why it works so amazingly, but I just wanted you to understand that we use near infrared and red. So when I say red light therapy, I'm talking about the integration of red and near infrared. And by the way, near infrared is invisible to the naked eye. So when someone looks at our bed, it'll look like some of the lights aren't on. They're on. They just, you need to wear certain eyewear to be able to see the rays that emanate from the near infrared. So the last thing is also the ability to pulse the wave. So our bed gives you the possibility of pulsing the wave. And what we do is we create a resonating frequency Some of you have heard of healing frequencies or resonating frequencies. A resonation or resonating frequency means that there are certain tissues in the person's body that resonate at different frequencies. And if we set the bed to those frequencies, we can affect those tissues better. And we have found that since we've been able to pulse the wave, which years ago we weren't able to do, that now we're able to affect the results have improved dramatically since we were able to do that. So now I'd like to finish with my background, and then I'm going to go over how and why it works. So I wanted you to take a look over here. So I think you have to write there. If I'm looking at the right spot, does it say YouTube anywhere?
Yep. Trifecta Light Official YouTube.
There's something blocking, so I can't see that. So if you go to YouTube and put in the @ sign and then Trifecta Light Official, you're going to see 140, I think, beautiful videos. They're great. Now, I'm also going to be sending you other videos as well. But I think that if you are interested in helping yourself or others, that you got to watch some of these videos. They're outstanding. And then also, I did write this book. I don't make a dime from it at all. Any profits go to charity. So I do recommend that you go to the Amazon and get it. It's called Illuminated Healing. So now I was going to go over why and how this thing works. And what they learned was what we've done is we've extracted certain elements of sunlight. Now, you know, over the centuries, it was people were told, why don't you go sit out in the sun and it'll help. And it does. There are certain elements of sunlight that will actually affect your body in a very positive way. So if you're living in a cave or you hardly ever go outside, that's not a good idea. We're recommending sunlight to a degree, at least some minutes every day that you get some sunlight if you can. And also I want to make it clear that we're not recommending just the bed. We're recommending smart eating, smart exercise, and the bed. When you have those three components, your quality of life will be wonderful. And what's most important for you to understand is that when you're younger, you don't appreciate the fact of what you're doing today, what kind of effect it's going to have on you later on. And if you listen carefully enough, you can hear your 75-year-old self crying because of the stupid things that you're doing. And I'm telling you, the reason why some people don't take care of themselves is they're not scared enough. They're not worried enough about what their future might be like. And I'm recommending that you get scared and be positive about how you take care of yourself. Smart eating, smart exercise. I'm not saying that's all you do. You can, within that smart eating, yes, there's some times where you can, you know, a lot of people in this country look at celebrations as consuming liquid and food that's otherwise considered junk. But for the most part, the majority of the stuff that you consume should be positive and helpful for you. And then from the exercise point of view, it's just 30 minutes 3 times a week. And what you want to do is to pump as much blood through your body, moving as many muscles as possible. So we like treadmill, if you like running outside, we like elliptical, things like that will move, again, as many muscles in your body, but most importantly, really pumping that blood throughout your body as much as possible. So I don't mind people using weights and all that, but we want the minimum of at least getting the cardiovascular happening. So now let's talk about how this thing works. What they found, as I said, is that it's sunlight. And what they've also found is that the 4 elements of sunlight that we have in our bed that we've magnified thousands of times and then drive it deep into the person's body stimulate certain tissues of your body that are critical. So we know that everybody's body is made up of tissues. The tissues are made up of cells. And within the cell is this one thing in particular, very important, what's called an organelle or component called the mitochondria. And what they've learned is how, over the years, more and more they're learning how important the mitochondria are to your body. And I just want you to get a notion, if you will pay attention, not you, but I mean your audience. I'm going to tell you something that when I first heard this was unbelievable. And what it is that the mitochondria, which is the powerhouse of the body, it's the reason why you breathe oxygen and eat food. It produces a molecule called ATP. If you don't have enough ATP, it will lead eventually to death, to disease and death. If you have the right amount, you can have that high quality of life that you will want when you're 75, because there are people, and when they get older, they can't feed themselves, they can't bathe themselves, and they can't even wipe themselves. And they allowed themselves to get to that position because they weren't scared enough when they were younger, when they could have taken better care of themselves. So I'm asking you, please start taking care of yourself if you're not. And if you are taking care of yourself, keep on doing that. So what they learned was that here you have this mitochondria when it's what they call dysfunctional. So they have a book called Mitochondrial Dysfunction. They have diseases that are essentially mitochondrial dysfunction. And what they learned is that the mitochondria makes up 10% of your body weight. I want that to sink in. Think about what else your body is made up of. And yet and still, the mitochondria makes up 10% of your body weight. That's how important it is, how prevalent it is. And we want to take great care of it. And guess how you take care of it? With certain elements of sunlight that our bed mimics and will magnify it many times and drive it into your body. And what they learned was that there's an element in the mitochondria called cytochrome C oxidase. It's actually an enzyme. And it is a chromophore, meaning that it is sensitive to these lights. And when we stimulate the body with these lights and stimulate the cytochrome C oxidase to force the mitochondria back to health, that's when this huge difference happens. And it ain't subtle. I already talked to you about Arnett. I could talk to you about Jessica, who, when I send you these videos, watch Jessica's video. When I called her, actually Zoomed with her, she had told me that she had a severe case of Lyme disease, and it ruined her life over the last 5 to 6 years or something like that. But when I started talking to her, it came up that, in fact, she had 16 very serious conditions that were ruining her life. She had 3 forms of psoriasis, including goutte psoriasis, plaque psoriasis, and psoriatic arthritis. She had so many other things. She had kidney problems, migraine problems. But one of the things she had was uveitis. Now, uveitis is a swelling in the eye, and normally your eye has a little bit of pressure in it of about 10 degrees, 10%. No, what is it? 10 milligrams. Anyhow, it's set at 10. The pressure is 10. And hers was 180. So she had a lot of pressure in that eye, and going untreated, it would lead to blindness in that eye. So the treatment, as things stood when I met her, was an injection right into her eye that she got once a month. And I asked her the stupid question of, well, what was that like? Well, I want you to watch that video. Again, her name is Jessica. When you watch that video, you'll see how she responds and how you might think somebody might respond when they're getting a needle right into their eye. The other treatment were drops, that her copayment just for the drops was $400 a month.
Oh, geez.
And that injection, each injection was billed to the insurance at $5,000 per injection. That was monthly. And after a relatively short period of time using the light with our bed, her pressure is normal. And her everything else. Imagine 16 very serious problems, and one of them was psoriatic arthritis, which was terrible. And she would wake up sometimes with dactylitis, which is essentially, they call it sausage toes. So she would wake up with her toes swollen and black and blue and very painful. And after 2 visits and ever since, that stopped. Did I expect that? I didn't even know she had that problem. But I'm just, all I can tell is we're just thrilled with the kind of results that people are experiencing. So the reason why we call the bed Trifecta is the triple effect of face, because the skin's going to look beautiful, fine lines and wrinkles are going to fade, fat loss, and healing. But then there are 4 other divisions. There's men's health, women's health, and the one that I want to talk about right now are athletes. When an athlete gets in our bed before their activity, they're going to perform better. I had a guy call me not that long ago and tell me, and he's a very serious swimmer, that he can now swim almost twice the distance he used to swim strictly because of this red light bed. And then the reason why our bed now is in a lot of athletic facilities, including with the NBA, with the Olympic Training Center, with other high-end athletic facilities, is because the people will get in the bed before their activity and perform much better. and they get into bed again after their activity, and they will recover much faster. We call it performance and recovery. There's a famous basketball player that within 2 weeks, when we signed agreements, I'll be able to reveal his name, but he's an older gentleman. He's one of the top basketball players ever, and it's going to extend his career. I'll just tell you that. So he'll be stronger, he'll be better, but also he'll be able to recover from any of the activities. And he's very excited about using our bed. And he uses it at the facility where he's at. We're trying to get it into his home so that he can use it more frequently. At any rate, so that's about the athletes. Now, I just want to also mention, so when someone gets in our bed, they keep their eyes closed, not wear the goggles, and keep their mouth open. So someone will say, well, is it dangerous? What if he opens his eyes? I told you, 50 years of studying this technology, there's never been a recorded side effect. Now, the light is stronger than heck. So I'm not suggesting keeping your eyes closed just because the light's so strong. But if you're worried if the light can get through your eyelid, we can get the energy goes through your skull to get to the brain. We know that it can get through the eyelid and get to the eye. So think about anything that could go wrong in the eye, including macular. We already talked about uveitis, macular degeneration, macular edema, cataracts, floaters. We have phenomenal results with floaters. Floaters are like, someone will notice, like gnats floating around their eye. We've had some people that actually blocks their vision. The floaters are so large, and they're gone typically within a few weeks, even shorter. So at any rate, you can see I can go on forever. I love this stuff. But my question to you is, do you have any questions?
When people go into the beds, are you clothed, I'm presuming? I actually don't know. I've never been in one myself.
Well, I'm a wise guy from New York. So when you ask that question, I would say, yes, when they get into bed, I wear my clothes.
Oh.
But if you're asking what they wear, I will tell you that the answer to that is the less clothes, the better.
Okay. I'm presuming it just penetrates deeper if there's less clothes.
It won't penetrate in some cases at all with certain clothing. So rather than take a chance, most people will be in their underwear or less.
Sure. So what's like a typical treatment? I know you kind of talked about earlier, like 3 days a week for so many minutes. Is that normally what you recommend, or are there different protocols?
Well, okay, so a dose is 12 minutes. That's number one.
Okay.
Typically, when a person comes in the first visit, the practitioner is going to figure out what the issues are and establish what the goal is. And we always try to get away from pain as being the goal. So if you just want to get somebody out of pain, that's the worst goal. I would tell my patient, look, if pain is the only issue you have, I'm going to just take this hammer and smack you across the head, knock you out, and you won't feel the pain. But that's not a smart goal. The dentists have taught you a long time ago, don't wait until your teeth are hurting before you take care of them, because by that point, you're going to possibly lose your teeth. Well, your health in general is the same way. You want to maintain and sustain good health before you're in pain. So again, we try to set up goals that are not pain oriented. So the first visit, we establish what is our goal. We'll see you 3 times a week until we reach that goal. Then at that point, we'll put you on a maintenance program. Maintenance could be as infrequent as once a month. At my age, my maintenance is 3 times a week. Again, I told you I'm 73 years old, and my goal is to not live as long as possible, but live as healthy as possible for as long as possible. So again, that's the difference between health span and lifespan. And so we use the phrase health span more commonly. The person gets in the bed 3 times a week, typically, until we reach the goal. However, let's say someone just burnt something, cut something, broke something, whatever. We'll see them once, if not twice a day. In fact, I mentioned with the athletes, they get in the bed early in the day, then they do their activity, and get again in the bed later in the day to recover from the activity. So the next morning, they wake up like nothing happened. Perfect.
Sure.
So it's not a steadfast, everybody's the same, but most chronic conditions are 3 times a week until we reach the goal.
For 73, you look really good. I would not have guessed that until you said it, and then your skin doesn't look 73.
Yeah, well, this is my avatar. This is actually me over here.
Oh.
Yeah. No, I work at it. Listen, I'm not telling you that it's just about the light. The light helps a lot. But, when I got scared enough, I told you that if you want to take better care of yourself, get scared. So I'd have patients come into my office and I would say to myself, please, God, don't let me wind up like that. And so it got me scared enough. I didn't come from the most disciplined family in the world. But what I would do is I don't smoke, never have. I don't drink alcohol, except like if it's a rare occasion. But basically, I don't drink alcohol. I don't eat crap food, fast food and junk like that. I just don't. But it's again not from discipline as much as it is. I want to do as well as I can for as long as I can. Let's put it that way.
Yeah, I worked in nursing homes for a long time, and you could tell which people took care of themselves and who didn't, because oftentimes the ones that took care of themselves and had an accident often got to go home and did okay, and the ones that didn't take care of themselves, could end up there long term.
Right.
I've seen people that are younger than my parents, and they're stuck there, so it's kind of eye-opening.
Yeah. Well, I mean, you would be a perfect person to describe what your audience should never experience if they could help it. You can't help the fact that you fell off a rock or something, hurting yourself. We understand that. And as you said, the healthier you are, the faster you'll recover. Look, there's a reason why everybody didn't succumb to COVID. And the ones that did succumb to COVID, typically they had comorbidities, which means that before COVID ever hit them, they were already sick. And the COVID just, did them in because they were already sick, as I say. I used to teach a class, which was not an easy class. I was in the first 6 months of my career, and I didn't know what I was doing. But I decided to teach a class which had something to do with sick people get sick and healthy people stay healthy. Now, I couldn't defend it. It sounded right. I felt right, but I didn't have the debating skills that I have now. So, because the first thing the person would say, what are you talking about? You mean only sick people get sick, so a healthy person never gets sick? And the actual argument to that is, well, they might get sick, but it'll be very much more mild. And then they would bring up lightning. Well, they're going to be affected by lightning or snake bites. So I didn't do well at my debates with all that. The truth of the matter is, just keep yourself as healthy as you can, and you'll be able to fight off most things out there.
Yeah, things that are within your control and not freak accidents.
Exactly.
So, are there any other risk groups that maybe should avoid this? I know you mentioned just pregnancy, but I think of things like open wounds maybe or lymphedema. I'm assuming I wouldn't really negatively affect it, but I guess I haven't worked with it enough to know.
If someone had an open wound, they shouldn't get in the bed. They should jump in the bed as fast as possible. We had a lady that had third-degree burns.
Oh,
She was guaranteed by the wound center to have 6 months of pain, 6 months of drugs, and permanent scarring. By the middle to end of second week, the pain was all gone. And by the end of the third week, it was gone. So, yeah, the open wounds, get in the damn bed. But as far as lymphedema and things like that, here's what I'm going to tell you. What I'd love for all of you to do is to go to Google Scholar. I don't know if you've ever heard of that. So Google Scholar looks a lot like Google, but it's the scholarly version. And I'll send you the show notes, which will include scholar.google.com. And then you put in the word photobiomodulation, which I think you mentioned before, right?
I don't think I said those exact words, but
So the word is photo, meaning Photo, meaning light,
yeah.
bio meaning cells, and modulation means, well, it was just a study of how light could affect the body. And if you put in the word photobiomodulation in Google Scholar, you're going to see thousands of studies and reviews. And then if you want to put any cancer, anything like that, put it in there after the photobiomodulation, put in anything else after that, and see how it helps lupus, how it helps just about anything, kidney, diabetes, multiple sclerosis. With multiple sclerosis, we're not going to reverse the damage already done, from what I can tell. But what we're able to do and what we're seeing is that will halt the progression. Now, multiple sclerosis is a disgusting progressive disease that only gets worse. And so our people will go back to the neurologist after a series of treatment with the red light. And the guy will say, well, I guess you changed your drugs or something like that because the scans look exactly the way they did last year. And the guy would say, no, I'm just using red light therapy. And the neurologists, they don't want to learn what is this red light therapy. They're not interested. And I'm going to tell you why. There's a lot more money in this direction, if you can see my hand, than there is in that direction. So here, so there's more money doing surgery and drugs than there is not. And so red light therapy, you can make a nice income if you have a red light bed in your facility, but you won't make the kind of money as you could with doing surgery, even if we're now telling you that in many cases, surgery is not necessary. So they're not supporting and getting behind this type of technology at this point because there's so much more money in drugs and surgery.
Yeah.
So to that end, I do want to mention why I think if you're anyone in the health industry, so that includes the entire fitness industry, beauty industry, health industry, weight loss industry, or any athletes, you should be using this bed in your business, or if you're an athlete in your home, let's say, because of what a huge difference it will be for you and for the other people that you're going to be treating. But it also makes money. I mean, it's like a magnet that will attract more people than you can imagine. And I just talked to this lady. She referred 18 people to the office where she goes to get treatment because remember, as I think I mentioned, satisfied patients don't refer. Excited patients are the ones that refer. And you're never going to see more excited patients. I've never seen this many excited patients as we have from this technology, where we could have somebody that had Leber's hereditary optic neuropathy. Nobody has an answer for him, nothing. And that was a guarantee of him going blind. LHON, there's a whole community of these people, and they're going blind. So we put red light therapy on it, and what we found is that we're not going to reverse the damage already done. It's just like it seemed like multiple sclerosis of the retina. The damage is already done, but we halt the progression of that LHON. So he's ecstatic. He was slated for being totally blind, and now he won't have to be totally blind. So he's happy as can be. So when you go to the website and go to trifectalight.com, go to the Contact Us page, on the left side, on the right side of that page is an opportunity for you to learn whether this makes sense to buy either for your home or for your business. And just see. I mean, there's no obligation. But again, I can't even begin to tell you how changing, not only for the patients, but for the owner of the business, how life-changing and business-changing something like this can be if you have it in your facility.
So what inspired you to write your book, Illuminated Healing?
It wasn't a great one aha. It was like, I'm honest with you and tell you that there was a lady that said, you should write a book. And I said, I barely have time to go pee. How am I going to write a book? And so I was helped. So I wrote my stuff, and I'm an okay writer, but I had an editor/publisher, these guys helping me, and they took my words and made it beautiful, really sing. So, I'm just grateful that to do it by myself, there's no way I could have, but I got my verbiage down. A lot of the research, like all the other studies and stuff, I didn't do that. I had people assisting me with that. I think I would have torn my hair out trying to do that. But the majority of it I wrote, and then they cleaned it up and just made it beautiful. So I'm not sure if the inspirations as well as it was just an opportunity. Someone said you should write it. I'm thinking, well, okay. I'll try to squeeze it in between all the million of other things I'm doing, because I'm doing a lot of talks and TED Talks and podcasts and all kinds of stuff. We do trade shows, and I try not to go there, have my staff go there, but sometimes, like this one that's coming up in Vegas at the Rio, and I think in 2 weeks, I'm just going there because I'm going to be giving a talk on that Saturday. That's basically it. But I'm busy. I'm doing all this stuff, and at 73, I thought I'd be, taking it easy, and I'm not taking it easy.
Yeah, you're still talking to people like me.
Yeah.
So is Illuminated Healing for the layperson, or who is it
Yeah, no,
written
it's
for?
it's well written both ways. So there's a lot of documentation in there that if you don't care about that, you just skip that. But no, especially the first several chapters are a great intro to how red light therapy has helped people and why it works and all that sort of stuff.
Sure. Well, so if someone is unsure if they want to try red light therapy, what advice would you give them?
Well, first of all, can you see that? You see what it says?
Yeah, get in the bed.
That's my advice. You go to the website, trifectalight.com, go to the Contact Us page, left side of that page, help us find a location closest to you. You go there for 6 visits. At the end of the 6 visits, I'm making you a bet that it's going to help if you have an issue. And also go back to the website, go to that Contact Us page and send me a note. On the bottom of that Contact Us page is a way for you to just send a notice to our company of what those 6 visits were like for you. And so far, we're close to 100% of the people are experiencing beautiful changes for themselves.
Wow, that's a good outcome.
I think so.
Do you want to mention your website again, or in your YouTube channel where people can find you at?
So you got trifectalight.com, and the tri is the triple effect of face, fat, and healing. So that's one way to remember it. It's like winning the trifecta at the racetrack. But it's trifectalight.com. And the YouTube channel, again, you go to YouTube, you put in the @ sign, and then Trifecta Light Official, which is right there, right?
Right there. And then where can people find your book at? On Amazon, I'm presuming?
Yeah. You go to Amazon, put in the Illuminated Healing, and yeah, it's a good read. It comes in Kindle form, which means you can read it on your computer. It comes as a regular book, and it also comes as, if you want to listen to 8 hours of me babbling on.
Did you read it?
Yeah, it's on audio.
That must have took a long time to record.
It took a long time.
Well, thank you so much, Dr. Carl, for joining me today. And I will link anything you send me in the show notes, so anyone listening or watching, you can find all the information there.
All right. It's been an absolute pleasure. I wish you all well.